Continue.
Yeah, Dr. Wang, did you examine the real human being brain?
When I say the brain of the cell,
Yeah.
I'm not saying the brain of the human body. But if you are asking whether Dr. Wang dissected the human brain, of course. When Dr. Wang was a medical student in Shanghai Medical University, Dr. Wang dissected the entire human body. As a medical student in all medical school students must do anatomy. This is the fundamental for the training of all doctors of the Western medicine. Okay, if Edward one day going to go to medical school, I will tell you, and now also Edward can hear this description. Okay, what does medical school teach? Okay, okay, the medical school students basically inside of China, the student goes through elementary school, 1, 2, 3, 4, 5, right?
Right.
Graduate from elementary school and start junior high, which is 6, 7, 8. Then senior high, which is 9, 10, 11. So in Chinese public education system, 5 years elementary school, 3 years junior high, 3 years senior high. Altogether 11 years. United States is called K-12. Kindergarten, 1, 2, 3, 4, 5. And then junior high basically is grade 6, 7, 8.
Yeah.
6, 7, 8, 9,
Yeah.
I think.
Some
6, 7, 8, 9. And then senior high is 10, 11, 12. So there is 1 extra year in American education. Chinese,
Korea also 12 years.
yeah, Chinese education only 11 years. Yeah. 1, 2, 3, 4, 5, elementary school. 6, 7, 8, junior high. 9, 10, 11, senior high. And the children starts at the age of 7.
Yeah.
Right?
7.
And then after 11 years, they're 18. And so the standard age to enter university is 18 years old. If Miss Lotus Blossom Weiss is studying in China, she should be now this year college. Yeah. So now I want to introduce the Chinese medical school education system. When Dr. Wang finished the senior high, she was 18 years old. She was not 18 years old because she went to school 1 year ahead of other people. So she was only 17. So she went to Shanghai Medical University, right?
That is the traditional age or Western age, 17 means.
Well, basically it's the Chinese way.
Chinese
For example,
traditional way, right?
For example, Western way is like, you have to have the whole circle completed.
Yeah.
But the Chinese people is like this. If this year is 2023, right? And you are born day 1, January 1st, 2023, right? You're 1 year old.
Yeah.
Chinese people consider you're 1 year old. And then 2024, you're 2 years old. You know what I mean? But for the Western calendar, if you are 2023, January 1st, you're just 1 day old. And then when you go to January 1st, 2024, you're 1 year old. Correct?
Yeah.
And then, so Chinese calendar, the age calculation is 1 year ahead of American age calculation too.
So 17 years, yeah.
So Dr. Wang was born in 1967. And if you plus 11 years, that's basically 1978.
Yeah, correct.
Then you add another 7 years before school, right? 6 years. So that's why Dr. Wang was only 17 years old. Okay. So anyway, the Chinese medical school goes like this. You go to medical school right after high school. American medical school goes like this. You graduate from high school, and then you need to go to university. And after 4 years of university, you apply for medical school.
Yeah.
So usually people in America going to medical school, they are in average 5 years older than the Chinese medical student. You see that? Yeah. In average, American medical school students are 5 years older than the Chinese medical school students. So Chinese education system shrinks the time, you know. That's why when Dr. Wang applied for PhD degree and become a PhD student, she was only 21. Actually, if she entered the school at 17, after 4 years, she was only 21. She already become a PhD student in America. But all her fellow classmates in the PhD program, they were already in their 30s. Most of them were in their 30s. Dr. Wang was only 21. So there is a huge age difference because of the education system different between America and China, right? Okay, now come back to talk about what does the medical school student study. When Dr. Wang entered the medical school in Shanghai, basically she had to take lots of classes. But the first important class for medical students to study is anatomy. Anatomy is to dissect the human body. Okay, so Dr. Wang needs to learn every part of the human body. The detailed structure of the human body, you know, from head to toe, with a little knife, and dissect every piece of skin, every piece of muscle.
You know, the dead person.
Yeah.
Bring their...
Correct. With a book next to each medical student, which has a picture of the human body structure. The student need to use a knife to cut open the human body and look into the layers of structures. Outside the layer is the skin. Underneath the skin is muscle. Underneath the muscle, inside of the muscle, you see the blood vessels. You need to differentiate whether it's vein or it's artery. Okay? And then you need to know the entire body's, you know, software. Not software, hardware. You basically need to know the structure of the body through dissection. Open up the chest to see the position of the heart, the structure of the heart, outside and inside, right? And to look at the lung, and to remember all the names of the lung, all the names, you know, of the different parts of the lung, all the names of the different parts of the heart, all the names of different parts of the blood vessels. It's a big time memory training for the medical student. Medical students enter medical school, they're just like everybody else who does not go to medical school. The only difference is that the medical school student, they need to memorize many different names and understand the structure of the human body as a molecular machine. Because when the person is already dead, you don't see the normal state of the body. Basically, the medical students learn the structure of the dead body, not the structure of a living body. Everything started by learning a dead body for the Western medicine. It's called anatomy. Okay. Then, another thing that medical students study is called histology. Histology basically is go one layer further to understand that after you dissect the body, you see that you have outside the skin, inside the muscle, inside of muscle you have blood and a nerve and a bone, right? So those things are called a tissue. So then histology is to examine the cells, the tissue under the microscope. You have a tissue cut into very thin, very thin pieces that the light can penetrate. And then you look under the microscope, 5-fold higher, 10-fold higher, 40-fold higher, 100-fold higher. You look at it and you look at the shape of the cells, right? That you need to very quickly understand. As soon as you have a slide under the microscope, you need to immediately say, this is the skin. This is the muscle. This is the bone. This is the neuron. Do you know what I mean? So those are the histology tests. The students need to recognize what is what, right? Under the microscope. Then the students study physiology. Physiology basically describes the function of the different parts of the body. Why our eyes can see. Why our nose can smell. Why our tongue can taste. Right? And why we feel pain. Why we can feel heat, right? Cold, pain, itchiness. What is the mechanism? Okay. Why our muscle moves, right? Why our heart beat, right? Why the kidney, can help the blood to be purified. How urine is generated, right? And what happens if you eat the food and enter into our stomach? What does the stomach do? And what does different parts of the intestine do? Right? That's called physiology. How our ear function to hear. How our brain can do different things. That's called physiology. So you have anatomy, you have histology, you have physiology. Then you also have neurobiology, basically specifically study the entire brain structure, different parts of the brain, what's their known function, and how they connect with each other, and how the nerves comes out to different parts of the body. And, this is the entire about the nervous system, okay? That's neurobiology, okay? So what else it covers? Pathology. Pathology is about disease. It's about what goes wrong for different type of disease. Okay, if you have a cold, what happened? If you have diarrhea, what happened, right? If you have a heart disease, what is going on behind the heart problem? So this is about try to explain the knowledge of different disease superficially at the cell level and at the organ level and the manifestation of it. When you have inflammation, you're supposed to always see that it's the place is red and the swelling, right? And, you have different kind of things that associated with disease. That's called pathology. Pathology. So medical students study those things. And so Dr. Wang studied all of that. And so those are the subjects of study in the medical school for 2 years. First 2 years, you study all those basic subjects. And then another 2 years in regular medical school, you go to practice in the hospital.
If you stay in the China, what kind of doctor will you to be there?
Any doctor. The medical student, when they go through medical school, they don't need to choose what doctor they will be. They study everything. After the basic study is finished, the 2 years, they also need to go through all departments. One period of time, they will study how to be a physician. Then another period of time, they will study how to be a surgeon. Another period of time, they will study how they're going to be a psychologist. Another period of time, they go through all the departments, all the different specifications of medical doctors. So all the students pretty much go over, they rotate. For example, every medical school have affiliated hospitals. Why? Because the medical students, after learning the basic knowledge, they need to go to different hospitals to learn very specifically how to practice medicine for different kind of patients. Some patients need medicine. Some patients need surgery, right? So that's why the practice of medicine is divided into many different categories. You have those doctors only basically, prescribe medicine. you have doctors who have a knife in their hand and they will perform surgery, right?
But the surgery, specialist, some, the heart specialist.
That's all after graduation. Only after graduation, when they have a degree of MD, then they need to do clinical training.
Training.
And the clinical training is the time that each medical student after graduation, they decide what they want to be specialized in. And then when they decide that they want to specialize in becoming a surgeon, very long journey. They have to, for the pediatric surgery, from medical student to really practice as a surgeon for the children, 9 years of training.
9 years.
Yeah, they are very strict. If you're not trained well, you cannot go become a surgeon for the children. Very, very professionally specialized trained. Okay. So you have just regular physician. Regular physician doesn't require that long.
So
okay.
China, the medical, the level is very high.
Very advanced.
Yeah, very high.
The training, because in China you have lots of talents. And the children that can enter into medical school is the top notch. The medical school children, the entrance selection is always the highest among the entire nation. The Chinese people's way of selecting, especially doctors, is placed at the highest position.
Yeah.
It's not like the United States. You go take a SAT, right? And then you just apply for all schools, things like that. In China, national entrance exam for college is only once a year. No second chance to retake. In America, you can take once, you can take 2, you can take 3, you can take 4. You can take as many times as you want for the college entrance exam. But China, only once. That one time will determine your future. And the administration of the test is whole nation, all the students take the exam together. Okay. So it's a big deal. Especially when Dr. Wang was, also corrupt. But the time Dr. Wang was in China, it's very serious. The selection of the talents in the nation is very serious. Yeah. So Dr. Wang was, top notch in the national entrance exam, national university entrance exam. And she gets to choose the best top college, medical college, medical university. So Shanghai Medical University was top notch. And that university requires 6 years. And the other school only 4 years, but that school requires 6 years. Because the students after graduation from that school is all top-notch leaders in the different medical field. So the reputation is very, very renowned, right? So anyway, when you ask me whether Dr. Wang did anatomy for the brain, yes, absolutely so. Dr. Wang knows every part of the brain, know the names, know the detailed structures, everything. So after 4 years in Shanghai, in the most top-notch medical school, Dr. Wang was very, very ready. She, in every regard, is better trained than any other students in comparison to the, University of Florida. They accepted 5 graduate students. Although Dr. Wang was only 21, she was from China, but Dr. Wang's caliber is far exceeding the rest of the 4 PhD students that University of Florida got in America. Because the intensity of study and the training and, in every regard, Chinese education system is so intense. And the requirement for the children in terms of their ability of rationality, math, physics, and chemistry, right? In the high school training is already very advanced inside of China, especially physics, chemistry. Okay. Biology was already taught. Physiology was already taught in high school. So the kind of intensive training for the young mind in China, American education system, there's no way can compare. That's why Dr. Wang entered into the graduate school, and 2 years later, Dr. Wang had to take a qualifying exam. Qualifying exam means whether you're qualified to become a PhD student. You know, if you cannot pass the qualifying exam, then you need to leave the PhD program. And when you leave the PhD program, you get a master's degree. So the intensive 2 years of PhD program in University of Florida Department of Anatomy and Cell Biology is a master's degree program. It's a speed-up master's degree program, as if. But, you know, you are given the chance to immediately take a qualifying exam. And once you pass the qualifying exam, you start your thesis work for PhD degree. So Dr. Wang did the qualifying exam together with the other 4 fellow graduate students. Guess what happened? 1988, 5 students entered this department as PhD student candidate. 2 years later, qualifying exam, only Dr. Wang passed. All of the other 4 American graduate students, every single one of them failed. So Dr. Wang passed the qualifying exam, and so basically that department only had 1 PhD from that batch.
So you 2 years
Dr. Wang, yeah. Dr. Wang, 2 years of study in University of Florida, Gainesville, and passed the qualifying exam, which is 1990. After that passing qualifying exam, Dr. Wang chose Dr. Jillian Small to be the thesis advisor and left University of Florida, Gainesville campus and came to New York. But she still belonged to University of Florida. She only basically, you know, followed Jillian Small as a visiting student in Mount Sinai. So she never transferred her status from Gainesville to Department of, you know, Medicine of Mount Sinai. Never. She was a visiting student in New York. So she continuously to receive scholarship from University of Florida. 4 years, Dr. Wang received scholarship from University of Florida. But she basically worked at a laboratory that relocated into Mount Sinai. And then 1992, Dr. Wang had to go back to University of Florida, Department of Anatomy and Cell Biology, to defend her thesis. When Dr. Wang finished the 2 years of work here, she published the 2 articles. And then she wrote her thesis. And then she shipped the thesis April 1992 back to University of Florida. And then December 1992, Dr. Wang went back to University of Florida and facing all her thesis committee. When you have a PhD, you have a committee of professors who monitor the quality of your work. And they are all top-notch. And they have to make sure that they consider this student is ready to be a doctor. So Dr. Wang need to present her research work to the committee members. And the Dr. Jillian Small is not part of the, is she also part of the committee? I think she is not, because it has to be external review. So Dr. Wang's thesis committee consists of Dr. Edward Wakeland and also Houseworth, I think that's the last name, and Baker. And there was somebody else. Lewin, Dr. Lewin. Lewin, Baker, Houseworth, and Wickland. 4 committee members was Dr. Wang's thesis, committee. Gillian Small was Dr. Wang's thesis advisor. But Gillian Small, as soon as Dr. Wang came to New York, she had some mental breakdown. She had some kind of personal, emotional problems. I think she suffered from depression. She had to go get medical care. So Dr. Wang basically did all the research on her own. She not only did all the research on her own, because Dr. Gillian Small was, getting medical attention for her crisis, psychological crisis. Dr. Gillian Small, as a professor, need to give lectures to the graduate students. That's her teaching duty. And Dr. Wang replaced her. Dr. Wang started to teach the graduate students the subject that Dr. Gillian Small was supposed to deliver. So Dr. Wang not only did the research on her own, but Dr. Wang even helped Gillian to balance out her crisis so that she could, continue. And when she returned from the medical care, she continued, with her responsibilities. That's why Dr. Wang could graduate so fast. Usually people don't graduate only after 2 years. No way. You're supposed to do research, follow your thesis advisor, many people 5 years. So Dr. Wang only did 2 years. And she already published 2 papers. So that's why when she delivered the thesis, defense for her thesis, she was already the leader in that area. And all the committee members really consider her to be absolutely outstanding. So was passed. So December 1992, basically Dr. Wang got her PhD. And that was the beautiful picture of Dr. Wang standing with the robe, the PhD robe, with a big, carnation flower in her arms, which, basically Kelly, Dr. Kelly Selman, the Jewish professor, originally from Harvard, and she interviewed Dr. Wang when Dr. Wang called collect from Shanghai, and then give her the mission. Kelly bought her the flowers. So that was a really big deal. I think that picture was taken by Mr. Allen.
Mr. Allen? Mr. Allen take the picture.
I think Mr. Allen took that picture. Mr. Allen already basically, the time already engaged. Dr. Wang and Mr. Allen were engaged. So Mr. Allen, went with Dr. Wang to Gainesville and attended the big-time celebration of the PhD graduation ceremony and took that picture. So that was pretty much it.